Hi, Dr. Pelto here. I'm going to go over a topic today that's called Functional Hallux Limitus. It's kind of a big word, and I'm going to go over it. It's different than regular Hallux Limitus, and you may be listening to this because you're one of my patients, or you may have been told about your doctor about this condition. This picture here, you might as well have a kind of a funky looking toenail here and maybe a callus right here. It doesn't always hurt, and there's not always a bunion for this condition called functional hallux limitus. These are the same slides that I go over with patients. I'm going to put a little link to my treatment sheet, which I call it, underneath this video. And you can get access to this. It'll have the treatment sheet, the slides, and other information if you want after this. You have to kind of look at how long you've had the symptoms and what are the symptoms you're having. There's a diversity of symptoms that you could have. Many times our patients come in with a toenail issue, ingrown toenail, and we find this functional hallux limitus. They might come in for Achilles tendonitis and they have this problem. This is like an underlying problem that causes a lot of other things. So we're going to talk about the treatments. You may not have had done any treatments because you probably didn't know what was going on. We'll talk about how it impacts your life and why you want treatment. So let me explain a little bit. Here's a couple of images you can see here for functional hallux limitus. So this is a normal one, this upper left-hand corner image. This is a normal joint without bearing weight on it. So normally you should get about 65 degrees of range of motion at your big toe joint if you're pushing up. Now, there's something called functional hallux limitus, which means if you put force underneath the big toe joint, and I'll show you a picture of that in a second. If you put force underneath that, it's going to reduce a little bit, but there still should be quite a bit of range of motion. The challenge is with our patients, many times when we push up on the bottom or we imitate their walking or functioning, it's going to really reduce the range of motion to under 15 degrees or not much. And the problem with this is then that has joint jamming every time that you're walking. So this is the main issue. There's also something called a structural hallux limitus, which is because of a bump in there, like either a bone spur or we call it joint mouse that doesn't allow it to bend. We're not talking about this type. We're going to talk more about this functional one that can be problematic for people. And many times you might be seeing your doctor and have never even heard of this. So we're going to kind of explain it. So if you push up, you can see this picture right here. If you push up and you have good range of motion, right? And that's okay. Okay. So if you push up and on the bottom and then the range of motion is limited, then that shows that there's functional hallux limitus. If you push up and there's good range of motion, then it shows it's okay. And so those are kind of examples of when you put up. You could try to do it yourself. It's kind of hard. You'd have to have someone else do it for you. Kind of like when you see a doctor, it's hard to do this exam by yourself. But basically, when you push up on the bottom, if there's limited range of motion, then you know it's functional hallux limitus. Or if you look at some of the symptoms, this functional one tends to have a great joint. These are examples of arthritic changes, and none of these really have arthritic changes. These are more advanced phases, and it might never even get to this. You might just have other types of symptoms versus these things. Okay, your joint might look totally normal on an X-ray. The one thing we tend to find on the X-ray, though, is something called first ray elevatus. So you can see that this first ray right here is a little bit elevated. So when you push up, it has a harder time clearing that joint space. This makes it hard when you're walking, and it tends to progress for a lot of our patients. Younger on, they're going to have the limitus. Later on, it's going to be rigidus. Okay, so what are the causes? It's basically caused by mechanical jamming of the joint, faulty function, and it eventually can lead to arthritis. This is the main thing where patients come into the office and they have toenail changes in thickness. This is one of the main things that I see. So patients with a thickened, wavy toenail, just on the big toenail, they might think it's a fungus, but a lot of times it isn't. So that is a sign of hallux limitus. Also the callus pattern. So hallux limitus, it tends not to have any callus underneath the big toe, the first metatarsal, but it has a callus right here on the side of the big toe, right here, okay, and then on the other toe. So what happens is it avoids putting pressure down here because specifically there's a tendon not working called the peroneus longus, which needs to function when you're standing. We'll go over that a little bit more. You're going to have a lot of times a hyperextension of the IPJ. What that means is that there's a joint right here and there's a joint right here. So this one tends to be hyperextended. It kind of looks like a I don't know, like a ski jump type of thing on the big toe because you're compensating because you can't get movement at this joint, so you're getting movement at this other joint. Okay. It could be a flat foot. So specifically, if you're not able to move the big toe joint, you tend to put your foot out, and so your foot flattens, and that's called external rotation, or your feet kind of turning outward. And many patients, because of all this adaptation or not having range of motion here, you kind of have to push or pull more with your Achilles tendon. So equinus develops, or calf tightness, or Achilles tendonitis, or plantar fasciitis, and then increased load to the other joints. Like I said, this joint's going to have increased load in the other joints up here. And reduced movement in this joint specifically. So if this joint isn't moving, these are going to all get bound down. So there's a greater tendency towards sesamoiditis and sesamoid pain. So what are the treatments? Well, there are a couple of treatments that are done with orthotics, and others that are done with physical therapy, and others that are done with surgery. We're not going to go too much into surgery because we can usually treat this non-surgically. But if you think about it, if you have limited ability to move the joint, if you drop the joint down, okay, so pushing it down into the ground, and then put the same force, it's going to move better. So this is called a first met cutout that you would put in orthotics. You would cut this portion out, and I'll show you an example in a little bit. Another option is, once you cut this out, if you preload the hallux, that's what we call preloading it, with a little bump, almost like a cheese wedge underneath it, it's going to get better range of motion. So if you preload the toe and then push up, it's going to work better. So there's a specific modification we do in an orthotic for that. Specifically, this preloading is called a Cluffy wedge you put in the orthotic, and then this is the first ray cutout that you put in the orthotic. So this is an example of a pair of orthotics for a patient with functional hallux limitus. Here's a couple of other examples. If you have a good joint, you want to increase the movement. So that's where you do the first ray cutout and the Cluffy wedge. And if you have a bad joint, such as like painful or arthritis in there, then you would try to reduce it with one of these extensors or these carbon fiber plates. There are some other treatments besides orthotics. We usually tend to recommend orthotics first, and then sometimes in conjunction with physical therapy. One is called peroneal strengthening. It's where there's the peroneus longus, which helps to pull down the big toe joint, or the first met head right here. And so if you strengthen that, it's going to make it load a little bit better. Sometimes that can be done with physical therapy. Sometimes it can be done with something called short foot exercises. So this is a resting foot, and this is a contracted foot. So when you kind of pull the foot and you kind of create a dome in the foot, you can do this multiple times to try to strengthen the inner muscles in the foot. So those are some things that can help. I put together this little graph to make it a little bit easier for patients for functional hallux limitus. You can see there are certain things to reduce pain. A lot of patients, once again, don't have pain. So this might not be indicated for you. Many patients, they just have jamming in the joints. So that's where the orthotics would be better. More of a rigid shoe if it's painful, or this insert if it's painful, and then physical therapy, and then surgery as the last option. Okay, so those are kind of the treatment options for functional hallux limitus. So this is a common condition for patients that's called functional hallux limitus. You might only have a toenail issue, you might have some sesamoid pain, you might have some Achilles pain, and this is something that's usually seen secondarily. Like, you're not coming in for this problem, but it's the underlying problem causing a lot of other issues, called functional hallux limitus.